Good afternoon, good afternoon, good afternoon. And it is a wonderful afternoon in my part of the world. It's not too hot and it's not too cold. It's just right. Not too sunny, not too cloudy. It's just right. Good afternoon. My name is Kate Hull Rodgers and I am here from Stepping Stone Theatre for Mental Health. And we are exactly that, a theatre company for people with mental health challenges. And I reckon that's pretty much everybody because we're all on the spectrum. But let's get on with the show. By my next task, I am introducing to you my favorite man, my favorite person, my favorite buddy, my bestest friend in the whole wide world, and my darling husband. Won't you please welcome Bill Rodgers?
You're getting all a bit all like proper, aren't you?
Well, when I grew up, the Tonight Show was hosted by Johnny Carson, and his right-hand man was called Ed McMahon, and he would every night do the introduction, and he would finish with, "Here's Johnny."
Okay.
And it sort of rubbed off
the
on
whole
me.
thing, you know, that it's not too hot and it's
And
not
too cold.
I
I start with my weather report.
But that's like extracts from Goldilocks.
It's exactly what it was.
You know what I mean?
I'm glad you picked up on that. That's
I mean,
exactly
mental
what
health's
it
an
is.
interesting concept, isn't it? I mean, and living with someone like you for so long who's got several mental health challenges, I'm never really sure what
what's normal.
what station we're on. Yeah.
Oh, yeah. We're on Goldilocks.
Radio 1, Radio 2, Goldilocks, Unicorn.
Yeah.
Oh, look, a butterfly looks like a squirrel. I don't know. Fascinating world in which you live, Kate. Fascinating world in which you live.
I like to think so.
Hi, crew. Welcome, Wendy. Wendy was chomping at the bit again.
Fantastic,
and she
Wendy.
definitely gets the Parma Violet gin. And there's Sam. He definitely wanted a decent whiskey. Yes, we did like the thing you shared on the group today, Sam. Sam's put a jar of positivity on. And it's a jar that we have to come up with a positive word and then kind of link into that.
Put it into the jar.
Yeah, put it into the jar. Jar
and
of
then
positivity.
if you're not feeling well, you go to the jar and you take something out and it reminds you of more positive times.
Well, absolutely, but it's more of a kind of online jar, really.
An online jar.
Yeah.
Oh, I'll have to check it out.
Yeah,
I've not seen it.
Yeah,
Brilliant. Thank you, Sam.
Hi, Adele. Welcome. Clive's there. Look, Clive and Adele, they were eager to get that decent wine, but Clive beat you to it, I'm afraid, Adele. So you've got the nice. It's all right. $4.99 from Lidl. It's not that bad. And there's Gemma and Gemma. Well, you did make it for the Avocar, but whoever comes next will get that little bottle of lager that's been hiding behind the Piccadilly since Boxing Day, but it's still there. It's still up for grabs. Still up for grabs. Hello, everyone. How are you? Well done. Welcome any new listeners out there. We are, as she said, Kate and Bill of Stepping Stone Theatre, and we're here to talk about all things mental health and everything related to it. Do not be offended if we don't wallow in the fact that mental health is a bad thing. Kate and I tend to look at it on the positive side because we care about the people that carry it, not the people that are ill. We don't care about illness, we care about the people that carry it. We label jars, not people. Sam got that right. There's only 8 people for now, Gemma, but I'm sure a lot more will come. Don't you worry. Good morning, Peter, all the way from Canada.
That's my boy.
It is indeed. So we always like to kick off with, how are you, Kate?
I am very well, Bill Rodgers. I am fine and dandy. I've been fine and dandy all day.
Yeah.
The last 3 days I've had morning anxiety, and today, none.
Brilliant.
And a lot of it has to do with discipline.
Yeah.
If I get up early, if I get up before the anxiety, then I generally don't have it. And I was up today. I was on the road for 7:30.
You were walking.
And I did my 10,000 steps, which I've now pretty much timed out. It takes an hour and 3/4 because I'm a slow walker. Let's just admit it. I'm a slow walker. But yeah, so if I can donate or designate the first couple of hours of my day to walking, I'm on to a winner. So I'm good. I'm good. Thank you very much.
I watched, I can't remember the name of the actor, but I watched a thing about James Corden yesterday.
Oh, yeah.
There's some actor or other that he went to his house. This actor gets up at 4 o'clock in the morning. Well, he gets up at 3 o'clock in the morning. He showers. He then does a workout, and he does a workout until about 5:30.
Okay.
From 3 o'clock, 4 o'clock in the morning to about 5:30. Then he eats, and then he prays.
Okay.
Yeah.
Yeah.
He does that, and then he was trying to get old James Corden to do the same. But James, a bit like me, exercise is good in practice, but not, when you actually physically. I do like exercise. I've not done it for so long. It's an age thing and all that with me as well now. But no, you have to discipline yourself.
It's total
to
discipline.
Do that kind of thing.
You have to day to day engage. And I listened yesterday to a podcast. I've been listening to a lot of podcasts, and this one just said motivation. So I thought, I'm in.
Yeah.
And the first podcast was about your morning, right?
Right.
And this guy for 6 minutes talked about how when your alarm goes off, that's your first decision. That's your first decision of the day. And if you decide to hit the snooze button, you have missed an opportunity to make a positive decision. And if you make a positive morning decision, then your day starts off right. So he's strongly advocating do not hit the snooze button. I was going to say booze. Snooze button, right?
Booze button.
But that basically what you do when your alarm goes off is your first decision. And if you decide to roll over and go back to bed when you had resolved the night before that you were going to get up, then you have, dare I say, failed. And so he did 6 minutes on don't snooze button.
It is difficult though. Gemma says she's been suffering with morning anxiety as well.
Oh.
I mean,
we should call each other.
I know, but the way round it for you is that you get up and do.
Yeah, absolutely.
Again, this is where I think that sometimes mental health can be selfish, because she gets up and she does stuff, but wakes me up at the same time. So when Kate gets up at 6 o'clock in the morning, she brings me a cup of tea at 7:30, I must admit. But when Kate gets up at 6:30 in the morning, I have to join in with the activity sometimes. You know what I mean?
There are many days, and I've just had a bout of 3 of them, when the anxiety is stronger than I am.
Yeah.
And I just have to dig deep. And sometimes I can't. Sometimes I don't know about you, Gemma, but I end up on the couch, and I go on the couch and I put a t-shirt over my head, and I block out the sun and the light, and I try to be still. And I don't know if that's the best thing, but that's what my body is telling me to do, and that's what the anxiety is telling me to do, and to be still. And then I feel the anxiety. So sometimes I can distract and be busy and get over it, and if I get up before it, seems to be a real positive thing to do. But there's many days when I think of it as a battle, and I would say there are many days.
It is indeed. It's a battle that you often win. Let's move on.
Yep.
We've done anxiety. We've covered it.
But
we all know how to deal with it. But let's move on, because there's far more things important from now until the end of the hour.
Absolutely.
Right. Anxiety will always be with us. We've made it our friend. We know what to do.
Yeah.
We just have to do it. We just have to do it.
Yeah.
So let's move on. Let's move on to joy. Any joy in the last 24 hours?
My joy in the last 24 hours is I have just led a writing workshop for 5 beautiful, in their own bodies, women of a certain age. And it was glorious. It was great. They came up with some really creative stuff, and they make my heart sing. So that's
you
my
have
joy.
a good group on a Tuesday afternoon, don't you?
I do. Small but perfect.
So
we
what
had
was
5 today.
What was the joyous? Well, the
joy was the writing exercise was to inherit money, and who would you give it away to?
Wow.
So you've inherited this money, 5 million quid, and you have to give it away to 5 charities. So all of us chose to do $1 million per charity.
Wow.
And it was fascinating. Homelessness, children, abroad, local. It was really interesting what people chose to give it away to. So yeah, so getting to know these women better and better, and what's close to their heart, it's wonderful.
It's interesting. I watch for my own relaxation after we had a busy day, because I've actually been in the office since crack of dawn this morning, because I've got a lot to do. But one of the things that I like to watch is like quiz shows, game shows. You know, like The Chase. I like The Chase. And interesting enough, Bradley Walsh always says, if you win the money, what are you going to do with it? And my heart is always thinking, say you're going to give it to the poor. Say you're going to give it to charity. You know, you wouldn't really need the money if you were on that show anyway. You know what I mean? You don't need it. You just got on for the Andy Warhol, everybody's going to be famous for 15 minutes. Right? You don't really need the money. And they always say, you know, I'm going to go to Australia.
Yeah.
You know, I'm having my kitchen done. Because we had it done 2 years ago and I still don't like it. You know, it's all very kind of materialistic what they're going to do with the money.
Materialistic and selfish.
Yeah. So interestingly, it's lovely that some people in your writing group want to give money to charity? Anybody want to give it to Stepping Stone?
3 of us.
Really?
I am absolutely overjoyed. Two of the participants and myself.
Brilliant. Well, there you go.
I gave us $1 million.
We started this morning skint, and now we're £3 million better off.
Absolutely, it was good.
Absolutely brilliant.
That was my positive.
Adele
says, got joy?
Adele's coffee at Costa. Sorry to miss Kate's group. Was on a mission to get more sponsors.
Ah, yes.
Well, there you go. When you're on a mission, you've got to go all the way to Costa's.
Yeah.
When it's really expensive.
It's a hard life.
Yeah, hard life, isn't it?
Yeah.
You could have gone to Greg's. It's 45 pence cheaper, and I'm sure you might have got more sponsors there, Adele. Wendy says suffering all day anxiety, but today I feel better. Heart palpitations not as bad. Brilliant, Wendy. Lovely to hear. That's the Palmer Violet gin. It does that for people. It relaxes them.
Ah.
Yeah.
That's why she was here first.
Yeah. I felt anxious all week as well. It's been awful, but still kept to a routine. Good.
Good.
With a upside down emoji.
Mm-hmm.
I don't know. That's the kind of statement, isn't it? But we have got room for joy. My joy, you were saying? Were you asking?
Oh, yes.
Do you really care?
I care very much what your joy is.
My joy is getting my son to town for his first haircut since
lockdown,
just after Christmas.
Yeah. And you can just imagine how hairy our son is.
Yeah, he takes after his father.
He had a big beard.
Huge beard.
Big hair.
And he's had a wonderful haircut. And my joy, the look on his face when I dropped him in town, he went, oh.
I know.
You know, because he does he is into his grooming, our son. And he has more hair care products than
we do.
Well, definitely me, I'll tell you. Definitely me. So that was my joy, getting our lad down to the hairdresser. Yep. Well, it's not, they don't call them barbers anymore.
No, what are they called?
A gentleman's hairdresser.
Ah, well.
Yes. Gentleman's hairdresser. And it's always like, you know, like hair by Frank or hair by Des, you know what I mean? They're not called, you know, barbers anymore with the old red and white pole. It's, you know, they've got names, you know, like Strong Arm.
Yeah,
you know.
There's one down there called Pink Pamper.
Yeah, all that. So that's where they've been.
Okay, good.
Brilliant. So we will try and help you with anxiety today. Stay with us, crew, because we've got a very interesting show. In fact, I'm going to give you a clue as to what the subject or the topic is. So here we go. Here's a clue.
Panic? No, we're not panicking. We're not panicking. Don't panic. 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 Don't panic, Mr. Mandarin. Don't panic. Now, don't panic, anyone. Don't panic, Mr. Mandarin. Don't panic. Don't panic. Don't panic. Don't panic. Don't panic. Don't panic. Now, don't get panic, Mr. Mandarin. Don't panic. Don't panic, sir. Don't panic. Don't panic.
Have we got any ideas what we might be talking about today? Have we got any ideas? Have a guess. Have a guess what we're talking about today. We are, in fact, yes, thank you very much, Sergeant Clive Dunn from Dad's Army. We are going to be talking about panic attacks. And
before you go, I'd just like to congratulate you. That's the first time you put a film segment in.
No, there's no film segment. They didn't see that. They only heard it.
Oh, they only heard it?
Yeah.
Okay. Ah, okay.
No film. I'm not that clever.
Oh, thank God I didn't.
I'm not that clever.
Itch myself in private places.
Well, please don't do that. I'm not that clever.
Okay.
Adele, Dad's Army, Clive Dunn.
Yeah. No panic, no panic.
Don't
no panic.
panic.
Don't panic.
Yeah, I didn't put a video segment in. It was audio, and you obviously weren't listening.
I was listening. I'm hard of hearing.
Don't panic.
I thought he was saying no panic.
No, don't panic. So that's what we're going to be talking about today, panic attacks.
Panic attacks.
Now, we have talked about panic a little bit in the past. Very early on in the shows when we were deciphering and decanting what we were going to talk about, we introduced panic into one of the shows in which we covered 3 or 4 subjects in the same show. What I'd really like to do, and it's interesting that we've got Gemma, it's interesting that we've got Wendy, who had panic attacks and anxiety with us today, that we are going to talk in more detail, hopefully, about panic attacks, causes, and hopefully what we can do to alleviate them slightly, my joy, my mum came visiting, having family time on the Wii. Well done, Gemma. Well done, family time. I love that, having family time. So that's what we're going to be talking about for the next hour or so, is panic attacks. I've been wanting to cover it in great detail ever since I've seen you have a couple. But I used to have a very dear friend of mine. He used to have panic attacks, and his panic attacks used to manifest himself that he couldn't get on public transport, or he couldn't get on trains, or the underground in London just crippled him. He used to get on the underground and he would count matches out of a matchbox and then count them back in, and woe betide, one missing. He'd be in a right state. And that's my very bestest friend in the world, Chris, who's no longer with us, sadly, but he was notorious for his panic attacks. And he would ring me at strange times of the day going, "Talk to me, Bill." And we used to sing together, and he was like got a terrific bass voice, and we would sing to each other down the phone just to get rid of his panic attack so he could get back in his vehicle and drive home. You know, panic attacks. Not easy when your breathing is bad. That's when I get mine due to asthma, says Peter. Hi, Janet, welcome. So panic attacks, Kate. I went on to Dr. Google, as I do, my famous kind of resource, and Dr. Google pointed me towards Professor and a scientist, no doubt, Wikipedia, who then brought me right back to a place where I love going, and that's to the NHS.
Aha! The NHS.
I went on to the NHS's
the National Health Service.
Vast website. Vast is huge. It's got everything on there. Everything. My grandmother used to have a book that used to say Home Doctor. It's a big fat book, and it said Home Doctor on it. And there's every ailment under the sun. I'd love to find out what happened to that book. But this is very similar now to that book. Is the NHS. It's got everything on there. So I went on and I talked to the scientists at the NHS to find out what panic attacks were.
Okay.
What they are. Peter says he gets his when his asthma's kicking in. But according to the NHS, a panic attack is when your body experiences a rush of intense mental and physical symptoms all at the same time. It comes very quickly, and it comes for no apparent reason. It's like lightning, right? And it's lots and lots and lots of symptoms all at the same time, right? And these symptoms can be, and often are, incredibly frightening and incredibly distressing, especially if you're having one for the first time. Now, I just want to throw this straight across to you, from my side of the medication cart to yours. I know you've had some, right? And I don't want to go into what you were going through at the time, because I've got all those here. How did it make you feel when you had your first panic attack, Kate?
My first panic attack?
Let's say that.
Just scared.
Yeah.
Scared. What's going on? What's happening, right? And I do differ a little from what you've outlined there. Is I had reactive panic attacks. So I knew what was happening, where they were where the negativity was coming from. Right. And so my first panic attack happened when I was driving.
Really?
Yes. Driving was too much for me.
In Canada?
In Canada, yeah.
Do tell.
Okay, well, I was driving, you'll like this, Peter, on the 401. I stayed in the slow lane.
Well, we'd like to know what that is as well.
It's a big motorway.
Thank you.
It's
Never mind you and Peter.
We want
Peter,
to know. We're bonding. We're bonding, keeping you out of it. But anyhow, I was on the 401, which is the big,
so a bit like the M1.
Toronto. Yes.
Right.
Yes, and I was in the slow lane because I'm thinking that's going less quickly. But the slow lane is where all the cars come in. So cars are constantly coming in and then moving over and all that. And I was in the slow lane. I don't think you're supposed to stay in the slow lane, but I stayed in the slow lane. Anyhow,
that's the driving lesson.
My breathing got up. My breathing got tight. My hands started to sweat. My brows started to sweat so much so that I couldn't see properly. So I signaled to the right and I pulled over onto the hard shoulder. It wasn't a lay-by or anything, but I pulled over and I just put my head on the steering wheel. And I didn't cry. I just breathed. I had to breathe. I had to get my breath up. And it took me quite a long time. And then I had to re-enter the motorway from not a slip road, but from just entering
off the hard shoulder.
So off the hard shoulder. So, that's a task and a half, especially when you have no confidence about driving. And I just drove maybe a mile on the 401 and took the first turn off. And I was there, trapped somewhere in Mississauga, which Peter will know is a far away from where I lived in Bradford, and far, far, far away. But I was no longer on the motorway. And slowly but surely, I made my way home.
So you went home the long way around.
But so how did I feel? I felt terrified, not just because I was in a 4,000-pound bomb that could explode at any point in time, but because I just could not make myself be confident Yeah, so that was my first ever panic attack.
Scary. If any of our crew out there are having panic attacks, please share these stories with us, because one of the things it says on the NHS website is that stories shared, we can start to alleviate it.
Absolutely.
Once we find out what starts them. I want to talk about some of the symptoms. You just talked about you felt tense, you felt you put your head on the steering wheel and all that kind of stuff. What the strange thing about panic attacks, right?
Yep.
One of the main things that I've read is that they can mirror other symptoms.
Yes.
They can mirror other symptoms. So kicking off, we've got a racing heartbeat, which is probably the first thing that happens when you start to have a panic attack. Your heart starts to race, right? Now, that, you know, some people might think that that's the beginnings of a heart attack.
Absolutely.
You know, the beginnings of a heart attack. And funnily enough, there are a lot of people that have, and I've read the stories, that have phoned for an ambulance. I'm having a heart attack, right? The ambulance has come, took them to A&E. They've got rushed in. They've had all the chest X-rays. They've got all the Bing Bong machines are put on, the ECG and all that kind of stuff. And basically, they're having a panic attack. But that has cost a lot of money to get. But well, you know, we pay into the system or what have you. It's a lot of money for someone to have a panic attack that thinks they're having a heart attack because the symptoms are mirrored.
Yeah.
It's not the patient's fault. You genuinely think that you are having a heart attack.
Yeah, and one of the things is not knowing, and so you panic, and so it's a catch-22 or whatever that's called, that you panic about the panic. Yeah?
Catch-22.
Yeah,
exactly.
Yeah.
Exactly right.
So it's horrendous.
One of the other things that they say is that you can start to feel faint. You know, having a panic attack. Wendy says, when I feel panicky, I get heart racing, sweating, dizzy, and I feel as though I'm going to faint.
There you go.
And that's the second on the list of many symptoms. That you're going to pass out.
That's right, because I presume because not enough blood's getting to your head.
Either that or it's too much blood.
Or too much blood, yeah.
Blood pressure.
Yeah, but whatever, the heart is working in such a way that the blood flow and the oxygen distribution is getting messed up.
Another one is that you start to sweat profusely. Now, I remember when I had my sepsis, I had sepsis, I was sweating like you wouldn't believe. Well, I could have quite easily said, I'm just having a panic attack. Even though the pain was excruciating.
Yeah.
But you sweat profusely. And you start nausea. Again, like Wendy says, she starts to feel sick.
Yeah.
Peter says, my son gets them due to heart palpitations, and he's called an ambulance a couple of times because he thinks he's having a heart attack.
Yeah, bless him.
You know, people do. The panic attack causes you to panic.
Yes.
This is the thing. Yeah. Chest pains. There we go again, next on the list. The biggie. Chest pains. And I'm sure lots and lots of people, like Peter just said, the doctor says he's fine, but, you know, do you believe the doctor? I don't know. I don't know the difference between a heart attack and a panic attack. I wouldn't know. I am not an expert in anything. Neither of us are, Kate, other than the stuff that we know about. Shortness of breath. That you find yourself, you can't breathe and all that. And I think that's because the heart starts to beat irregularly and it's not feeding the oxygen to the lungs to...
Yeah, and we've all seen the archetypal panic attack of the person gulping their breath and gulping their breath and whatnot. And so that really is a signal that what's happening is a panic attack.
Normally out comes the old brown paper bag when they start to hyperventilate as well.
And as I say, the panic attacks that I've had have all been about something. But how frightening is that when you just out of the blue, and no wonder you think, oh, I must be having a heart attack because there's no cause for this. But a panic attack full on can come at any time.
You suddenly get really chilly, or you start getting chills as well.
Chills.
So you're sweating, but you're cold.
Yeah.
And then the strangest thing starts to happen is that you have uncontrollable shaking. You know, so there's lots of things that are being mirrored right there.
Yeah.
You know what I mean? Lots of things that are being mirrored. You've got heart attack. You've got shortness of breath, so there's blood pressure issues. You've got trembling, so you might have got a cold, you might have got a fever. But really, you're just having a panic attack.
Not just, but yeah.
Well, you know what I mean.
I know.
You're having a panic attack.
You're not having a heart attack.
Anyway, I gave you some homework, and you came up...
yes. Well, some other of the symptoms that happen with a panic attack, choking.
Yeah.
You feel like you're choking. The throat closes. The throat is, you know, where the larynx is and the voice production is so sensitive to emotion, and so you get a choking sensation. Yeah. Another one is, as Wendy's just said, dizziness. Yeah, again, there's not enough blood happening in that, and real sensation.
Not enough happening. What?
Enough blood happening.
Right. Okay. Got you.
Yeah.
I'm just looking at Adele. Adele, you just reminded me.
Yeah.
What you said. Adele said stress caused my first panic attack. I recall I was driving like you, Kate. Managed to get home and almost collapsed.
Yeah. Yeah. It's very powerful stuff. Look at Gemma. I've been hospitalized for a panic attack. I seriously thought I was going to die. They are very serious.
Carry on then, Kate.
And
very serious.
We'll come on to
We're going to come on to all that, yeah.
But another thing that can happen, and you don't get all these symptoms, but you get some of them, is numbness and pins and needles. Pins and needles, particularly in your hands, and just a buzzing, so you're getting the trembling, and you're also getting pins and needles.
I used to get pins and needles in my fingers.
Yeah. And again, associated with the throat again is you get dry mouth.
Yeah.
All of a sudden, the production of saliva gets messed up when you're having a panic attack.
Which is very similar to epilepsy and diabetes. Because you drink a lot when you're diabetic. You're always constantly thirsty. So again, the mirroring stuff. The mirroring stuff. I'm sorry to put you off, but
not at all. But another one that is a sudden need to go to the toilet.
Yes.
Yeah. So all your intestines, all your bowel, all your kidney, all that stuff gets engaged in this as well, and you have a sudden need to pee.
So your whole body just kind of goes into some kind of shock, really.
You can also notice ringing in your ears.
Again, could be put down as tinnitus. Another mirroring.
But so now you're gulping for air, your heart, you can feel the palpitations, you've got pins and needles, so you're shaking, your throat's closing, you're sweating, you're cold, you're whole, like
you're
Gemma
hot.
says, you're cold, you're hot.
Yeah.
I got chills. They're
multiplying.
Yeah. That was the word I was looking for.
I know.
Thank you, darling.
You're trying to do.
Me and musicals.
You're trying to do a funny joke from Greece, then, weren't you?
I was.
It just didn't work.
Thank you for saving me. Yeah.
Leave the gags to Bill.
And here it comes, Gemma. A feeling of dread or a fear of dying.
Yeah.
Now I can speak to and attest to that with another panic attack that I had, which was in bed here where we live now. So it's about 10 years ago. And I was on the bed and I couldn't move and I couldn't move and I couldn't lift my head. And I thought, this is it. This is it. I'm dying. I'm dying. And you phoned the NHS.
I did.
You did a 111, right? And before too long, I was speaking to a doctor. You held the phone to my ear because I couldn't move my hands. I couldn't move, right? And he just spoke very calmly and he said, I think you're having a panic attack.
Yeah, I know.
I
was there.
I cannot tell you though how freeing and exciting that was, that I wasn't having a heart attack, that there might be another explanation. And as soon as he said that, something released in me.
It certainly did.
And the stress left my body and I began the recovery. And before I knew it, I could sit up and you gave me some water. But that was horrendous. And I was absolutely convinced this is it. This is what it's like to die.
And I'll tell you something else from a carer's point of view, from this side of the medication cart. I remember that night well. I did not know what to do.
I know.
Because this was a new one.
Yeah.
It was like, it was the Thursday illness. We had bipolar Monday, anxiety Tuesday, depressive Wednesday, and on a Thursday,
But the thing in that particular instance, I thought, this doctor is diagnosing over the phone.
Yeah.
And we are giving him, between the two of us, symptoms of death. And he just very quietly, and he didn't know my whole history of mental illness or any. He just very quietly said, I think you're having a panic attack.
But it's interesting. Is she sweating? Yes.
Yes.
Is she cold?
Yes. Yes.
Is she warm? Yes.
I know.
Is she drinking? No. Is she thirsty? Yes.
Yeah.
All there.
And finally, we've already mentioned it, but not just a tightness in the gut, is a churning in the stomach. So all those acids and that are kicking in, right? A tingling in the fingers. So it could be the pins and needles, but just a tingling, right? And here's one, and I can attest to this as well. Feeling like you're not connected to your body.
Explain that.
Well, it's almost like, the only way I could explain it, it's like an out-of-body experience where you just feel total disconnect. And I've actually had where I can look back at my body from a different perspective that is outside of my body.
Well, like astral projection.
Astral projection.
You can leave your body and look at yourself.
That's it.
Wow.
And that's pretty much a pretty good list of symptoms of a panic
Gemma
attack.
says that she gets pins and needles as well, and it's awful. You don't know what to do, and in the morning my chest was so painful that I couldn't breathe, and my face and hands were tingling. It's scary, so scary. And Peter says, boy, this is so nice to hear others talk about this, knowing that you aren't the only one that's having them.
Yeah. Do you know what? That's a real truth, right? Is when something like this happens, you do feel like, I can't explain it. I can't describe it. I can't, like you often, when I'm having an anxiety attack, which I think is slightly different than a panic attack, right? You say to me, talk me through it. Talk to me. Tell me what's happening. And that thing of, I can't. And that thing of, you do feel alone.
Well, it's interesting researching it as well. Yes, they're called panic attacks when you're having them, but it's actually called panic disorder. It's actually got a real proper, but it's not a mental health problem.
What do you mean by that?
Apparently, it's nothing to do with mental health.
Oh, because it's so physical.
Yeah.
And it's happening so physically.
And it's a mixture of lots of things.
Yeah.
They're not really sure why or what causes them yet. Still, the jury is still out on that. But it's not like schizophrenia. It's not like bipolar. It's more connected, I suppose, than disconnected.
Okay.
There's more joints to it.
Very interesting.
They reckon as well, the experts say that most panic attacks, they last between 5 to 20 minutes, right? But some of them can last for up to an hour.
Oh my gosh.
Yeah.
Oh my gosh.
If you're counting.
See,
if you're counting, that hour can seem like 10 hours, I'm sure.
I consider myself very lucky because when I've had panic attacks, except for that one that was in the bed, right? I know what the stimuli is. So I very often, like now when I have a little anxiety attack, I leave the room. Yeah. I change the stimuli. I no longer drive at all.
I know. I know, having passed your test in England.
Yeah, I know.
With one of the nicest driving instructors.
On a gear shift, I was able to do, I tell you, very impressive.
Yeah, using the old manual gearbox and all that,
But, so this causes me panic attacks, so I am not doing it. So people who have panic attacks that come from nowhere for no apparent reason, that's got to be a lot more difficult to deal with.
Well, Gemma says that she had one that lasted through the night into the next day.
Wow.
That is a long time.
Wow.
The NHS also said that the number of attacks that you have depending on how severe your condition is. Some people will have an attack once or twice a month. Some people have attacks several times a week. That must be horrendous.
Yeah.
It must be horrendous.
Yeah.
I mean, you've been lucky. You've had several since I've known you. But we could probably count on two hands how many you've had.
Well, and the thing is that we discuss them before, we discuss them after, and one of the strongest things that you and I have come out of it with is this too will pass.
This too will pass.
Even if it's lasting through the night, we know this will change. This will change. It will cease to be.
I suppose the light at the end of the tunnel, the experts actually say, however frightening and scary and misguided they can be, mirroring with the heart attack and heart palpitations, the panic attacks are not dangerous.
No.
Unless you're driving.
Yeah, unless you're operating
machinery or you're driving or you're doing something. Yeah. But if you were just suddenly to have one in the house, they're not dangerous.
And I think another thing that's good about panic attacks is that they start gently.
Yeah.
So you get so that you can start to recognize, you know, that. So at least in my experience, it started gently, and it built up and built up and built up, and then becomes unmanageable.
That's the scary side of it, isn't it?
But just to go back to operating big machinery, you can feel it coming on, so you can turn the machine off. Do you know what I mean?
Yeah. Again,
if you're driving,
very similar to epilepsy. That if you're epileptic, you know that you're about to have some kind of fit.
I think so.
You get the aura. It's called the aura.
That's right.
Yeah,
so,
and that could be a smell or a feeling or a sound. Yeah, you get the aura. Wendy says she's been feeling like this for the last few days, It's been worrying, and that's made it worse.
Okay.
And that's what I'm saying. You have a panic attack, and then you start to panic.
Yeah, about
it gets
panic.
worse and worse.
Yeah.
Basically, you've got to be careful because you might do yourself some physical harm while you're having it. That's the only thing you can do. And if you do that, there's a fair chance that you will be admitted to hospital. But only for the harm that you've done yourself,
right,
not for the panic attack.
Yeah.
Unless you think you are having a heart attack. I mean, it is a spiral. It's a catch-22, isn't it? Be aware of these symptoms, though, like we've said, because they can mirror other symptoms. But what I'm going to say now is, if they are mirroring other symptoms, like Peter said about his son, Peter says, "Great show. Sorry, I've got to leave. Hope to get on while I'm on holiday. Have a wonderful time wherever you're going."
He's not going on the 401.
Okay. Have a wonderful time, Peter. Farewell and bon voyage, as the French Canadians would say. Au revoir.
Au revoir.
Yeah. What I'm saying is, don't be afraid to call the experts.
No.
If you think that you are having chest pains, palpitations, sweating, don't think, oh, it's just another panic attack, because you never know.
You never know.
It could be a heart attack.
That's right.
I mean, I sat on my couch for about 3 or 4 hours before calling an expert when I was having my heart attack, because it was very asymptomatic. I was just a bit breathless, and a bit sweaty. And I put it down to the fact that it was July. I am 3 years on the 23rd of this month is when I had my heart attack.
It is indeed.
And I just put it down to hot weather, You may have a racing heart rate, right, during a panic attack, but it could be blood pressure. Do call the experts. That's what they're there for.
That's right.
That's what they're there for. So, Kate, I'm going to throw this over to you now, because you've been there, you've done that. A lot of our pals out there have been there and done that. At what point do I say, right, I need to go and see an expert? At what point?
When you are feeling that you need to see an expert.
Okay.
If that thought comes in your head, then call the expert. Yeah. So see a GP if you are experiencing symptoms of panic disorder. Yeah. You don't have to go through it alone. They will ask you to describe your symptoms. They will ask how often they occur, and they will ask how long they stay with you. Yeah. So in other words, the calling of an emergency that you think you're having a heart attack, that's one kind of intervention with the NHS. The other is that your panic attack has happened, you've wrote it out, you've ridden it through, but now in a good state of mental and physical health,
go and see your GP.
You go and see your GP.
Got you.
There's something amiss. Yeah. And it is a disorder, plain and simple. Yeah. So as I say, they'll ask you to describe your symptoms, how often, how strong, how severe, what happens, and whatnot. They may also, when you see them, carry out a physical examination just to rule out that it isn't a physical thing, that it's actually is panic attacks.
Yeah, absolutely.
Yeah.
And that will vary from person to person, depending.
And they will ask you your mental health history as well.
Of course.
Because this impacts greatly on why you have panic attacks, because many panic attacks are reactive to mental illness. They do go hand in hand. And you can be diagnosed with panic disorder if your experience is recurrent. And if you have panic attacks at least once a month, is when they're talking about that you probably have a disorder.
That's a recurring problem if it's about one.
And we will talk about the treatments pretty soon. But yeah, so that about covers what happens.
So they reckon it's a disorder if you have one once a month?
More once a month, yeah.
Okay.
Yeah.
Gemma says, I now know the signs, so I tend to occupy myself to try and stop it.
That's my girl.
Yeah,
That's
very good.
spot on.
Very good. Okay, so I've seen my GP.
Yep.
I've told him that it wasn't a heart attack, and he's told me it wasn't a heart attack. What can I do, Kate?
Okay. Your treatment is aiming to reduce the number of panic attacks you have and to reduce the severity when you do have them.
Yeah.
That's what you're looking at,
Okay,
right?
yeah.
And there are two interventions, as you can imagine. There is psychological and there is medical.
Yes, of course.
So there is
every time.
Talk therapy and there is medication.
Yeah.
Because medication can help with anxiety and medication can help with panic attacks.
Rightio.
Yeah.
Yeah.
Anything that's going to have that much physicality associated with it will be impacted by medicine, as they call it.
Yep.
Yeah. Now, with psychological therapies, you can refer yourself directly.
And what are these?
Talk therapy.
Right, okay.
And the favorite talk therapy for panic attacks is CBT, cognitive behavioral therapy.
We did an entire show about CBT.
We did an entire show about CBT.
Because I did not know what it was.
And I will now do it in a sentence.
Yeah.
It's basically, CBT is looking at how you think and is challenging the negative thoughts so that you will think differently.
Okay, yeah.
Yeah?
Yeah.
So it helps to change the way you think and to challenge unhelpful thoughts. There you go. And what you do in CBT very often is you look at the problem, right, and you break it down into bite-sized pieces.
And what we
baby
discovered,
step by baby step.
what we discovered on the show that we did about CBT is that you can do it yourself.
You can.
There's lots of online courses.
Well, I will hold my hand up to. I have done it myself.
Oh, right,
So
okay.
I have read books and I have read self-help and they all. CBT is just, it's so clever. It's like mindfulness. It's everywhere. It's everywhere. I have never done a formal with an expert CBT course.
Right.
You know, and it's not on my to-do list because I think I know everything already.
Well, I'm sure you do, and you do a lot of things. You do practice a lot of things.
Yeah.
10,000 steps and swinging the crystals and all that kind of stuff.
That's right. So the moral of the story is that you can refer yourself. You can also go to the GP and they will refer you. And you know, it's always good to have the GP in on your journey.
Yeah, on your court.
So that when you need them, right?
Absolutely.
And the therapist will simply teach you ways of changing your behavior, and they will teach you things such as breathing techniques, and they will teach you how to calm down during the attack.
Yeah.
And they will teach you to do exactly what Gemma just talked about, distraction.
Yeah.
Keep yourself busy.
Busy till it's
Keep
gone off.
yourself thinking other thoughts.
Yeah.
Yeah. And you know, if you have panicky nighttime and it prevents you from sleeping, well, I overthink at nighttime, so I now listen to a guided meditation with my headphones.
You do?
Chill, 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 and sleep is coming. Now the medicine, the general thing is that they will prescribe an antidepressant. They will describe SSRIs generally, which is selective serotonin reuptake inhibitor. Serotonin is one of the neurotransmitters that tells your brain how to behave, and so basically it inhibits it being reuptake,
which
so
is what
it stays in your system longer.
Which is what you've been taking for
I've been on
a number of years.
SSRIs for, you know, on and off, and they've tried slightly different ones, but the SSRIs work really well.
Yeah.
And they have the least amount of side effects. The other is you can get anti-epilepsy drugs such as pregabalin, and I am on pregabalin.
You are?
And it worked overnight. With an antidepressant, it takes 2 to 4 weeks to start to kick in, and probably 8 weeks before it's working at optimum. So this is really tricky, you know, if you're having anxiety attacks or panic attacks or depression, that you have to wait 8 weeks before that medicine is doing its journey.
Well, if you break your leg and you put a cast on, you've got to wait 8 to 12 weeks before that bone heals itself.
But, you know, you have very difficulty not getting, you know, you take an antibiotic, you get better.
I know.
You take an ibuprofen, you get better. You take an
it's very short-lived though.
Oh yeah, but you take an antidepressant, you got to wait.
Yeah.
But the anti-epilepsy drug that I'm on, pregabalin, hey man, it worked instantly. Instantly, my anxiety was lessened.
A lot less.
It works on another transmitter called GABA, and GABA is good. And so pregabalin, the hint is in the name, works on that. And so those are the two things that they might prescribe for you, an antidepressant or an anti-epilepsy, yeah?
I'm going to give you 1 minute to advocate medication then.
Advocate?
Yeah, would you say between those two, CBT and talk therapy and doing a bit of self-care, or an SSRI and a GABA medication, which would you prefer?
Well, that's unfair. I would prefer a combination.
Okay.
So I would do both the psychological intervention and the medical intervention.
You would?
And I would put them hand in hand. Absolutely.
I'm just asking from this side of medication.
And I personally would not self-refer. I would have the medical team in on every decision that I made in my psychological journey.
Okay.
That's why I have a psychiatrist, and he knows exactly what I'm doing and what I'm thinking, and together we make decisions about my medication.
Absolutely.
So that's how it works for me.
Absolutely.
It's not going to work that way for everybody, but that's what over 30 years I've been playing this game.
I know.
And that's what I do. So you were going to talk about referrals.
I'm going to talk about referrals, but what I want to talk about just this very quickly. I just want to hit on what you just said because I've got about 30 seconds. Is watching you and your journey of right, and you said you're on pregabalin now. The other week you messed about with it a little bit. You lowered a dose here, and you took an early morning dose there. I'm just going to say, if you've been referred a bit of CBT, go and do it. If you've been given medication, keep taking that medication. Even if you think it's not working for you to start with, keep taking it and don't do any changes until you and your GP decide to do so, until you and your medical expert decide to do so. And that's what you did the other week. You tried to change them, it didn't work. We put them back to where they were, and they're fine now. Yeah.
Medication is only one option.
Oh, I know.
And many people don't like medication. Many people don't like the idea of it, and that it means you're ill, that you must be taking.
I know.
And there are huge side effects to medication. There are huge side effects. So I would always say, think long and hard if you want to go down that route. Okay,
that was my minute that you just took it.
Okay, go.
Thank you very much. Basically, if your symptoms do not improve, what they're suggesting, the NHS does suggest, is try and find yourself a support group. Try and look for a group of people who may be going through the same thing. There's lots of them online. There's lots of them locally as well. So have a look for a support group and try and join one and find out the ins and outs of what's going on. Find out the ins and outs of what you're going through, what panic attacks are, and what can be done. The specialists will carry out an assessment on you when they see you, Kate, and then it's up to you and your specialist to come up with whatever plan suits you. And one of the things that I looked deep into on the NHS is what to do, during these attacks. Having seen you, what to do. And I think one of the things is when I think it's Gemma said that she sits down and waits, distracts herself. Well, that's what they also recommend. They said don't fight the attack is a main thing. Don't fight it. Try and sit down, find somewhere, because the next thing on my list is stay where you are, if possible. Yeah, stay there. Don't move. Don't try and get home if you're having an attack in the car. Stay where you are. Often people, says Adele, feel better and stop taking meds, but as soon as they do, it's a backward slide. Only when we do realise this, that meds are actually working. You're not wrong.
Good point. Good point.
Stay where you are and breathe. Breathe slowly. We've talked a little bit about meditation before, about finding your calm point, finding what's really good for you, and they advise that stay where you are. If you know you're having your attack and it's coming, stay there and breathe, and remind yourself that this attack will pass. What's your favourite saying?
This too will pass.
This too will pass.
It's my fridge magnet.
It's your fridge magnet, mate. It is indeed. Focus on the positive. Focus on peaceful things, on calm things, right? Try and drift away from what you're going through. Try and find something nice to focus on, let's say. And always remember that it's not life-threatening. They do say it's not life-threatening if you know how to handle it, unless you're driving or operating machinery. We've talked about that before.
That, if I may, that would be fighting it, right? If you keep driving when you're having a panic attack, you are fighting the panic attack. No. You pull over and you let the panic subside.
Absolutely. It may also help to read some self-help books. In our last 10 minutes, we're going to cover a few things that we can do that you can help yourself with. self-help books on CBT, information online, complementary therapies. You're a great advocate of complementary therapies.
I am.
Such as?
Well, aromatherapy,
Yeah.
which is the smell sense,
Yeah.
yeah, plus the oil,
Yeah.
massage therapy,
Yeah.
acupuncture,
Yeah.
your chiropractic, osteopath, absolutely complementary therapies, and then you get into your complementary movement stuff, yoga.
Yeah.
You know, yoga with those positions that they put you in, and the breathing, Pilates, getting your core strong, fantastic.
Good. Anything else?
Well, you can learn breathing techniques. So it's not just breathe deeply, right? But you can actually learn breathe and hold it at the top of the breath and then breathe out fully. To breathe out fully is quite a task. And you get better at it if you practice it.
Kelly says breathing is so important on a panic attack. Focusing on a flower, a leaf could also help too.
That goes to the grounding that we were talking about the other day.
It does indeed.
You know,
we did a whole show on that as well. It says here a little bit of regular exercise, not too physical, just regular. We talked about that nearly every day, how good your walking is and how it impacts on your physical and mental health. We now know that a good old walk is also very, very good for a panic attack. This is your favourite one, I think. The one on the list there. Avoiding the sugar.
Thank you. Yeah. Avoid sugary food and sugary drinks.
Yeah.
Avoid caffeine.
Yeah.
Which I'm pretty religious that I don't have caffeine after 1 p.m.
Yeah.
Alcohol. Yeah.
Yeah.
Alcohol for a few reasons, because we don't want to be self-medicating too much.
Yeah.
And also alcohol with most psychiatric drugs mixed is just plain ordinary not a good idea.
Not a good idea.
And then one that you can attest to, Bill, is stop smoking.
Stop smoking.
Because all of these things can make your attacks more regular and worse.
Yeah. Nicotine. It is a drug.
Caffeine, sugar.
Yeah.
You know.
All of those things. If you can't stop them completely, and I know some of us can't, cut them out a bit.
Yeah.
I have done.
Yeah.
I've cut a lot of sugar out of my diet.
Makes a huge difference to your well-being.
It certainly does. Again, I spoke about support groups earlier, but try and find a group. There's lots of them online. For example,
the Crazy Crew has become a group.
Oh, the Crazy Crew's online. Anybody who wants to join the Crazy Crew, just let me know. Answer 3 simple questions and become a member of the Crazy Crew. If you're going to refer a friend, can you make sure that we know who they are and that they know they've got to answer 3 simple questions? It's all to do with
safeguarding vulnerable adults.
Vulnerable adults, that's what it is. The groups you can go to: Anxiety UK, their door's always open. Mind, my great favourite resource is Mind. Always go to them for everything. No Panic, go online, it's another site. And one that you've got there, Kate, Triumph Over Phobia. Triumph Over Phobia.
Also known as TOP.
Right, Top. Top UK is their website as well.
And they help with phobias and OCD, because phobias, when you have a fear of something, you can have a panic attack when you see that something or when you get exposed to it. If you have a phobia of spiders, you see a spider, your breathing starts to go. You know, it's that kind of thing. So TOP, which is Triumph Over Phobia, can help with that.
You've got literally 1 minute, Kate, to tell us about complications that could happen.
Right. What I've got here is panic disorder is treatable.
Yeah.
And you can make a full recovery. I haven't had a panic attack extraordinaire for several years now. So, you know, it's best to seek medical help as soon as it is.
Absolutely.
If you cannot seek medical help, your panic disorder might escalate and become very difficult to cope with. You're more at risk of developing other mental health conditions such as agoraphobia, or other phobias, or if you're self-medicating, an alcohol or drug problem, If you have panic disorder, you must tell the DVLA.
Ah, yes. Yes, the people that give you your driving license.
If you have something wrong with you, dare I say, that could affect your ability to drive legally, you are responsible to inform the DVLA. So there you go.
I just want to quickly go back to one that you did. That we've got 30 seconds on this, and that is the increasing conditions such as agoraphobia, etc. I think there's going to be a lot of people during lockdown, and when lockdown comes at the end of this lockdown, that are going to people. Bye, Gemma. Thanks for popping on, mate. Who are going to be agoraphobic. I think a lot of people will be frightened to come out, and I think that we may have a few people that may have some kind of disorder like this, these panic attacks. Yeah. I just wanted to throw that in. As a mental health condition, the exact same cause, it's not fully understood. It's one of those that's panic attacks are still in beta. They're still kind of testing and finding out why, what, where, and how. That's why they do basically give you medication that is suitable for epilepsy and anxiety as well. But it's thought that the condition, there's 3 schools of thought on it, on where it comes from.
Okay.
One is a traumatic and stressful life experience such as bereavement, and I can believe that. Grief and bereavement, because grief has now been recognised as a mental illness by the experts, the doctors and nurses. But yes, it can come from a life experience such as that, a breakdown in a relationship, loss of...
So it's almost like a PTSD.
Yeah, post-traumatic stress, absolutely. Yeah, it can be triggered by that, absolutely. Having a close family member with the disorder, there's certain kind of experiments going on about genetics, that if somebody's got it in your house or you've witnessed it, there's a fair chance that you might have the gene, what goes with it. But again, that's still very, very early days. And an imbalance of neurotransmitters, which disperse the chemical messages in the brain. And I think that's probably where yours lies.
Sure, that's why medication helps.
Yeah, because of the brain synapses talking to each other, and in some cases speaking gobbledygook. In a lot of cases. Adele says, I dreaded going out, but it wasn't so bad as I thought. I've been wearing a mask and it made me feel safer.
Yep.
That's lovely. And Kate, finally, in the final 3 minutes or 2 minutes of this, you are going to tell us about early intervention.
Yeah. Panic disorders very often start in the teenage years. Yeah. So panic attacks are particularly hard on young people. Yeah. And if you have a teenager in your life, or if you are a teenager, right, and you're experiencing these gentle symptoms, get to the GP. Early intervention is the answer to avoiding.
I agree, because kids are under a lot of pressure, especially now. They've been locked up for a long time. They've been forced to go back to school. They're halfway through their exams. Some's been doing their exams online. Some's been studying online. Some went to university and they're not at university because university's shut. And they're going back to school in September. They break up, technically. They break up this week. You know what I mean? And they haven't been to school for 7 or 8 weeks. And
it's rife for mental illness.
Bless them. I would hate to be a child right now.
Yeah.
And they go back to school in September. There's probably going to be half the kids that they were at school with last March that they won't even recognise them. They won't even recognise them. So there's
very difficult.
There's no wonder they're going to go through all this kind of panic attack. So yeah, early intervention.
Early intervention always.
Absolutely. Carry on then, mate. Sorry I interrupted you.
Well, no, just all I wanted to say about it is that, you know, if you have a teenager or you are a teenager, you could refer them to CBT. They can learn how young people can learn how to deal with their emotions and their sensations and their thinking and their behavior. Yeah, it is very treatable. And, you know, it's nothing to be embarrassed about. It's nothing to stigmatize about. It is just a fact of life. And, you know, as Bill's just said, it could be genetic. Yeah, it could be, you know, that a grandparent dies. And processing that has flicked the fight or flight.
But either way, I think with anything, especially with lockdown as well, which is primarily what we tend to touch on a regular basis, early intervention with all mental health is the key.
Once again, yeah.
Early intervention is the key.
So there you go. That's what panic attacks look like. That's how you can treat them. That's what you should do. And what causes them. I think we've covered it all, Bill.
And that's what we know about it. So thank you once again, crew. I will just, in a nutshell, give you a little blast of this.
Don't
panic. Don't panic! Don't panic! Don't panic! Don't panic! Don't panic! Don't panic! Don't panic, sir! Don't panic, sir! Don't panic! Don't panic! Don't panic! Don't panic!
So there you go. Don't panic.
Brilliant. Well done, Bill.
We'll try our best. Once again, crew, thank you ever so much for your input. Very interesting. And I am learning a hell of a lot from all of you, and especially from Kate over there. Certain things that Kate and I have talked about over the last 25 years, and certain things we've never even touched because they've never come up in conversation.
No.
Really. Really great show today, guys. Has let me revisit the issues of anxiety and panic as someone who luckily hasn't experienced them firsthand, but having to support someone who suffers from both. It's so useful sharing insight. You're very welcome, Katie, and thank you for being a support and being there.
Yep.
Wendy,
Thank you,
you ever so much. You, as always, Kate, have been a mine of information.
As have you, Bill.
As have you, Bill.
Oh,
Thank
no,
you
you're
very
the
much.
best.
No, you're the best.
Go on, then.
Oh,
I'll take that.
oh, yeah. There you go. Say bye-bye to your friend.
Bye-bye, and thank you.
See you later, my mates. Have a wonderful rest of your day. We won't see you tomorrow. It's Wednesday and it's broadband issue day.
Yep, we have tomorrow off.
Well, she says we have tomorrow off. We've got 2 meetings.
Well, you know.
And I've got to go to my GP tomorrow and have my blood pressure checked. So I hope I just don't have a panic attack on the way there.
Yeah.
Because do you know what they call that when your blood pressure goes up?
I do.
White coat syndrome.
That's right.
That's what I'm going to be going through tomorrow. Have a wonderful, wonderful rest of your afternoon, guys. We will see you on Thursday, though. And I'm going to tell you on Thursday we're going to be talking about... I am 2 days ahead of myself, but who are you going to call? There you go. We will see you. This is the Yorkshire Pudding saying ta-da, thank you very much. What a lovely time we've had with each other. And my pal over there will say...
And it's me, Kate the Great, the crazy Canuck.
She certainly is. I can vouch for that.
Bless you.
Right, what do we do now?
I think you asked me to say bye-bye.
Oh, go on then.
I can do it without you asking.
Oh, go on then. Yeah,
I've been
you're
practicing.
a grown-up. You're a grown-up.
Bye-bye, everyone.
Well done. Say bye-bye,
It's good,
Kate.
isn't it? No S's in there for me to
Brilliant.
lisp on.
Say bye-bye, Kate.
Bye-bye, Kate.
There you go. I knew you'd get it wrong.
Perfect. What? How did I get that wrong?
Because you just said your own name. They're going to think you're really silly.
No.
Yeah.
No, I'm supposed to go bye-bye.
Just bye-bye will do.
Just bye-bye will do.
Oh, for goodness sake.
There we go.